our viewers. Welcome again to the Entrepreneur TV show. My name is Lucy Jeffrey. I am so happy to bring you this show. This is our fifth year now, and I'm so happy to bring you business owners in London, Ontario, so you can see where to seek services from businesses that are trusted by the Entrepreneur Nation. And I would like to remind you that this show is sponsored by the Entrepreneur Nation. The Entrepreneur Nation is a business development group. It's a business referral group here in London, Ontario, that I started in 2018, and it's been going on covering several places in the country. So the Entrepreneur Nation has been sponsoring for the entire time, but we have also welcomed other sponsors to sponsor the show. I would like to let you know that our sponsor, the next sponsor that I have is Alex Valili. And Alex Valili is a commercial litigation lawyer with Mackenzie Lake Lawyers. And he decided to sponsor the show because he actually serves business owners. And so that's why he thought of doing that. I would like to let you know that today our guest is none other than Alex, and you're going to get to know him more. He's very well known in London, Ontario. And when I turn the screen, Alex will be speaking to us right away. Hello, Alex. How are you doing?
I'm doing well, Lucy. How are you?
Good. I did not actually mention your last name because I hate mispronouncing people's names. Do you mind pronouncing your last name to our viewers?
Even I get my last name wrong, so it's fine. It's Alex Hanham, Medpoint Healthcare.
Awesome. Thank you so much, Alex. And I hope you don't mind if I call you by your first name in this show.
Absolutely, go ahead.
Awesome. Alex, I know how busy you are and how I've been wanting to bring you to the show, but I'm happy that you have made it, and our viewers will be happy to learn about you. So I want to start you off because I say people do business with people they know, like, and trust. We already like you ourselves, but we want our viewers to like you so they can do business with Medpoint Healthcare. Would you mind telling our viewers a little bit about yourself before Medpoint?
Okay, sure. I was a competitive swimmer. I guess that's the big thing. I swam for the University of Western Ontario, where I met my wife, who eventually became my business partner, Dr. Sylvia Murchison. We moved out to Kingston. We moved back to London so she could go to medical school. I had many years working. I worked at the Future Shop. I worked at Rogers Television, where this show is being broadcast on. For many years, I was there for 8 years, creating shows as exciting as yours. And then we decided to leave from there. We decided to start a new venture, which was Medpoint, and decided to work together. So.
Awesome. Our viewers, I don't know if I should feel uncomfortable now that Alex was doing these shows before me. He has more experience than me, but I'll do my best, Alex. We're happy to know you. And I've heard you talk about your wife wonderfully several times, and I've always wanted to meet her. So thank you so much. We'll definitely get to hear more about her. So I wanted to ask you then, so after all that, you decided to start MedPoint Healthcare. Can you tell us a little bit more about why you decided to start and where it's located?
Well, I know we only have about 30 minutes on this interview, so that's a 30-minute question right there. But I'll run through it really quickly. I had a very successful, very enjoyable time working with Rogers Television. However, I kind of felt like it was a bit of a training ground for me eventually to run my own business. And I read a book called Boom Bust and Echo, which is by David Foote. And I really recommend everybody go out and get that book because it was a life changer for us. And really, we looked at what the demographics and what the baby boom generation and the bust generation and the echo generation, which we now call Gen X and millennials, and now Gen Z, what that was going to impact on different parts of society. And the baby boomers have changed everything. And eventually we realized they were going to change healthcare. And so, when we talk about baby boomers, we talk about the silver tsunami, the challenges that will happen to our healthcare system that was already taxed. And my wife felt a little frustrated coming out of medical school and having to deal with a lot of patients dealing with chronic health issues that could have been prevented had there been a focus on prevention maybe 20 years earlier in their lives. And so we looked at, where is healthcare going and what are some possible solutions for the system, which seems to be broken. And this was 20 years ago we started this conversation. And we had a young family. My daughters were 5 and 3 at the time, 5 and 2 at the time. But we decided to make the leap, get entrepreneurial. Let's start it. And, we immediately, we became business owners. And I guess that was where it started.
Awesome. Great. That's good to know, Alex, that you're an entrepreneur. I really like dealing with entrepreneurs. So let me ask you then, can you give us then, you started that, you wanted, and I understand where you're coming from, because we don't go to see the doctors before we are sick. We go to see the doctors after we are sick or when we are sick. So you wanted to prevent. So give us a quick then overview of Medpoint Healthcare, its mission in the healthcare industry.
That's a great question. When we first came out, my wife came out with what our mission should be. And for a long time, it really took a while for me to really click into what it is. And as we've gone through, we've been in business 17 years, and it really has come full circle now where we fully get it. We know what we're doing, and our mission is twofold. One is we are disease mitigation. So we want to catch disease in the early stages, cancer, diabetes, heart disease. Let's do the screening. Let's provide access to people. Let's navigate the system. Let's look after their healthcare. And then the second part, which has been horribly missed in healthcare overall, is lifestyle modification. So how do we identify risk factors and then eliminate those risk factors through lifestyle modification? So if you have high blood pressure, you have a high heart rate, if you are having some, your A1C is getting out of control, if we have the concerns for diabetes, if you drink, if you smoke, if you don't exercise, if you eat bad foods, if your stress is too high, how do we identify those risk factors and then eliminate or reduce them so that people can live longer, healthier, happier lives?
Wonderful. This is really great. And I'm happy to say that I'm also a client of Medpoint after I met you. I didn't know about Medpoint, and I'm hoping so many people will come back there to get that help. So let me ask you then, the healthcare industry is always a changing industry. The landscape is always changing. So how do you feel that Medpoint has positioned themselves, and how are they contributing to the changing landscape in the health industry?
Well, we're very well positioned at this point. To be honest, maybe I was like all entrepreneurs. Maybe you're fatalistically optimistic and you believe that everything's going to be great right off the bat. We always joke that success is going to be a straight line, and it's not. It's a wiggly line, and there's ups and downs and challenges. But we did know that the healthcare system was on the verge of collapse, and that there was a number of different factors. And one of the factors wasn't just the increased demand for healthcare because of the baby boom generation, but the other aspect of that was that the providers themselves, the doctors, the nurses, the technicians, were also baby boomers, and that would be coming to a retirement. So we really had this perfect storm that is coming of people who are going to look for preventative healthcare that is just not provided through our system. And we also have a generation of baby boomers who really have high expectations. And we knew that they wouldn't be able to, the system itself wouldn't be able to deliver it. So when we looked at what some of the places in Toronto were doing, we knew there were, 2, sometimes 3 times our price for similar services. And what we looked at was we knew what executive healthcare was. It's healthcare for executives. Companies send their executives to make sure that they're healthy and that they are, around to be executives in that company for a long, long time. So they put that investment in. And our concept was, well, if executives can get it, that's great. We'll help them too. But we should make this affordable for the general population. So how does an everyday person who wants to focus on prevention and not have to go to the doctor just because they're sick, how do we give them that same opportunity to live healthier lives? And so we've always based that on, we have this very small market of executives who qualify, but let's make it affordable to the general population. And really, I think that's been one of the keys to our success.
Awesome. Great, Alex. Thank you. You're doing great. And as I said, I never heard about this, but I know you are the president and CEO at Medpoint. I think you don't deal with the medical side of things. So I wanted to talk to you about Dr. Sylvia Murchison. I'm hoping I'm pronouncing the name correctly. The medical director at Medpoint Health Care. What is her role, and how do you feel she has contributed to the success of this company?
Well, quite honestly, we built the organization around Sylvia. Dr. Murchison, in my opinion, is one of the smartest and top family physicians in Southwestern Ontario. She's the smartest person I've ever met in my entire life, and except her choice in men is horrible. Other than that, she could have been she was top of her class in every specialty during her residency program. She could have been a surgeon. She could have been a cardiologist, but she always had a passion for family medicine. And she really, she's probably the most humble person that I've ever come across as well. But she's really been a game changer in the healthcare industry, where she's diligently has researches findings to, as many a late night that she has stayed up late researching things. And over the years, she's proven that. We had a case where she found something and documented it, that it was so rare. There's only been 55 of them ever recorded in the history of medicine. It was an infected cardiac myxoma. We found that through our clinic, and the person had open heart surgery the night that it was discovered. So not with us, but we sent them to the hospital with all the information. So we do come across a lot of sort of rare sort of cases and hard to figure out cases. And she's been able to set the pace for our physicians. We have very high standards for who we bring on to the company. And our focus is, and our mandate is the beat of the drum that she hits. We march to her, I'm saying that horribly, but we march to the drum beat that she's drumming, and which is lifestyle modification, disease modification, disease identification, and lifestyle modification.
Awesome. I really like your sense of humor. And you say something and you never even smile, Alex. I don't know if our viewers caught that, but we are going to come back to it at some point. But let me ask you, and I thank you for talking about the doctor and showing that really she was there. And so that way you have been able to create this together. So I wanted to ask you then to elaborate to our viewers in a little bit more details. I know you have mentioned the exact services that are offered at Medpoint.
So, what we're mainly known for is our comprehensive medicals. So we have 3-hour medicals, 4-hour medicals, and 5-hour medicals. And then that identifies health risks. And then the next step would be, how do we get people to that next step? So when we would do a referral, we often have internal referrals. We've been blessed that because of our reputation, because of Dr. Murchison's reputation, we've had a number of specialists over the years come to us and say, I would like to work at Medpoint. I'm retiring. I would like to finish my years, with the mandate of Medpoint. And so we've been able to attract a number of specialists. At one point, I believe we go as high as 28 physicians, but retirements of some have brought us, I think, down to around 24 physicians. Currently, we have 5 family doctors, with another one about to join us. Full-time physician about to join us, and 19 specialists. And again, a lot of them, some of those doctors work 1 day a month, and some of those doctors work 3 days a week. So it really depends on what is the fit, and how is it a benefit to our clients. Our job really is to deliver exceptional level healthcare to our clientele, to our patients. And when you have a business like this, the clients and the feedback and the staff evolve the organization. So when we get into other services like our fitness, we have a medically integrated fitness program where we take the information from the client and from the medical, and then we can customize a plan through a kinesiologist in our fitness facilities that is able to help them with their goals. We have technology that will give us information that clients don't even know about themselves, including their the VO2 max, which and VO2 submax, which will give us their aerobic threshold and their anaerobic threshold, which will allow us to say this is the exact point or heart rate where you are going to maximize your fit loss. And we do that by a test called VO2 max, where they wear the mask over their face while they're exercising. It collects their volume of blood gases, does an analysis, and says, hey, you know how you're working out at 130 heartbeats? Well, that's not doing you any good because you're not losing any fat at that point. And in my case, I stopped burning fat at 120. I burn the most fat at 85. So the good news is I can work out less and get better results.
Awesome. And you know what? We'll talk about that again, Alex. I'm just saving some things, viewers, for the last, because there's a time I saw you running and you ran for 5 kilometers nonstop. So we'll talk about that at the end of this show. So, Alex, I wanted to ask you, you are in the healthcare industry and you know the challenges over the last 2-3 years that we have experienced worldwide because of the pandemic. How did Medpoint set themselves for success? How did you protect your clients, your patients, your employees? I know I came and joined Medpoint when we were being masked. I came there wearing mask. I saw the steps that you took. But please, can you explain to our viewers what happened and how you managed it?
Well, once the first, that was an interesting transition time for us. We had actually sold Medpoint to a larger corporation. The partnership really didn't work very well. So we actually took back control of Medpoint in 2020 after the first wave of COVID. And because we were in a challenging situation at the time, not just with COVID, but from what had happened over the last couple of years, it was a very tumultuous time. The positive part for that was that we opened after a few months to a full house. Clients were clamoring to see a doctor in person. They had a number of challenges. There was some frustration in accessing healthcare services. And so when we opened the doors again in June 2020, we really didn't, we started off in a full out sprint and have continued that. We have grown to the point where we have never been busier. And again, we have had to, of course, with all the safety protocols and everything that we put into place, we were able to see patients in person. We are also, because we have a medically integrated fitness program, when all the other gyms got shut down, all of our clients were also patients. And so we were able to stay open in our fitness facilities as well. And we had all the protocols in place. So I think the main, I'm not sure if I'm answering your question properly, but the main reason for our success has been our team. We have an amazing team who are very dedicated to our clients, and a great team of physicians. And we find solutions. And sometimes if someone's looking for a private option or looking for a faster option, not only if we can't provide it, we can find people and systems and places that can provide that. So it's not, I think in healthcare there's a lot of, well, that's just how it is. And and to a certain extent in our system, there's massive challenges and wait times and everything that comes with that. But if you have a positive attitude and a motivation through the company to find solutions, if you're looking for solutions, you'll probably find them. And that's what we do as a team.
Thank you, Alex. Thank you for doing that. I know it was challenging for you, but I know that even I've known you through the CEO Club, which we'll talk about. I know you have done the best you can to keep everyone safe. So I want to ask you a personal question, and you are welcome not to answer it, or you are welcome to answer it the way you want. I know you work with your wife. So how easy or difficult is it to work with your wife, Alex?
Hmm. Well, she introduces me as her first husband a lot, so I think that's a bit of a challenge. I think that when we decided to start the business, I had a lot of clients who work with their spouse, and they all went, "No, don't do that. Don't do that." I think it's a lot harder for her to work with me than it is for me to work with her. When, especially in the formidable years, Medpoint and Dr. Murchison were the same company. They were the same entity. It was, we built the business around her reputation and how good a physician she was. And I knew that going in because in my job at Rogers, I had clients of Rogers who I would get in to see her, and she would fix or figure out something that they've been dealing with for a long, long time. And they were just, wow, she's amazing. So I knew that it's a lot easier for me to work with her. Now, for her to work with me is, you've seen me in meetings. I think I go for the joke and the humor probably more times than I probably should. Now imagine a lifetime of that. So there is an innate challenge of running a business in healthcare, and definitely at times we will conflict, but we're always going to do what's best for the patient, and then secondly, what's best for the company. So it is a challenge. I think that in healthcare needs to be run like a business. In many cases, it's not. And that's really how we've gotten ourselves into some of the problems as a society.
Thank you so much. I actually put myself here so I can smile and viewers can see, because your sense of humor again. And so I applaud both of you from being able to work together. I know I've tried even to work with my son. I've tried to work with my family, and we can't work together. So I applaud both of you for making it so successful, both at home and at work. Thank you. You are a role model for many couples. So let me ask you then, I want us to go to giving back. I know you give back, Medpoint giving back. And recently you even invited me for an event. I don't want to steal the show. Would you please share with our viewers about the giving back?
Well, I think corporations have a responsibility to give back to their community, and I think one of the biggest, and any company is, the reality is once you start getting successful, you'll be inundated with requests for charity, and we've often helped out gone to different golf tournaments, donated prizes, but for many years we've sort of looked at what is the thing we can get behind, and because we cover so many different things. I think there has to be a personal aspect to it and a motivation, and or else you're just writing a check. And our motivation came in when I was invited to be a part of the McCormick Home group from my friend Twee Brown, who's a friend and a neighbor, and on the committee. And she said, "I want Alex on this committee," and she asked me to join it. And so we came up with different ideas, and they have an annual event called Fit for Care, and we decided to make it into a fun run last year and to raise money. And because my mother is or was a resident at McCormick Home. Sadly, this year my mom did succumb to Alzheimer's after living there for 6 years, and that was a few years after my father had passed away from Alzheimer's. So we really, it's a passion for me to be able to help an organization like McCormick Home. And on the day that she passed away, I was meeting with the organizers at a set meeting, and I said, and they knew that my mom had passed away that day. It was obviously a very emotional day. And I said, what about honoring my mom's memory and creating the run, and we'll support it for the next 5 years, and we'll call it Maggie's Run. And Maggie was obviously my mom's name. She was a prenatal nurse. Everyone loved my mom. And Alzheimer's is a horrible disease and a very difficult disease to deal with for family and also for the staff workers. And the people at McCormick have just done an amazing job. They have their systems down, and it's just a great organization to be a part of, doing very challenging work. So this year, and thank you, Lucy, for your support, for coming to Maggie's Run and honoring my mother like that. We raised over $42,000 this year with sponsorship and donations, and next year I'm looking at really ramping that up as well. We have the commitment for the next 4 years. This was the first of 5 years, and I really believe that it's a great thing for the West End of London, for the Byron community, and all of London to participate. And the money and the funds go to such great causes.
Awesome. Thank you. And I'm sorry for your loss about your mom. And I actually heard it on radio. You didn't even tell me, Alex. I heard on radio, that is Alex. And then I listened again. So that's when I emailed you and said, I'm coming to learn. I think you have done it in a way that it combines physical fitness and giving back. So to me, it was very exciting. And please put me in. I'll be there all the time. And now that I know, I'll start contributing earlier so I can help you to achieve your goals.
Really appreciate that. Thank you.
Awesome. Now, Alex, we are coming to an end. We really would love to have you here the entire time. Maybe we'll even invite you another time. But I want us now to focus on the CEOs Club in London, Ontario. You are part of the CEOs Club, and this is your second year. Thank you so much. Do you know, Alex, you have never missed even one meeting, even one.
I find that hard to believe. I think I must have missed one, but
it's not that I track attendance, but I'm always knowing that Alex is going to be there. So how has it worked for you? How have you worked with other CEOs, and how do you find it going forward? How do you find it working for you going forward?
I think it's been like monetarily wise. We've a lot of people have jumped in and come to become Medpoint clients. So it's been financially good for us and beneficial. It's something that we're in the black for. So that works for me right off the bat. The other part is that it's the interactions with other business owners, and to see that we all have similar challenges and to see different approaches. And I really, first off, I joined because once you started asking me about it, I figured you were not going to stop asking me about it. So I figured it was easier just to start coming in and getting a breakfast, once a month, and we'll see what happens. But it's a really good group, and it's a very diverse group, and yet very similar, that we face the similar challenges. And when we bring in different guests, and I know you have some more exciting guests that are going to come in, these are people that maybe I've wanted to talk to for a long time, but just don't have the time. And now they're coming in, and we can actually have a conversation and see where there's crossover and learning from other people. Really, when you're an entrepreneur, and this is where I'll do a plug for your organization. When you're an entrepreneur, you're kind of alone on an island a lot of the times, and you try and figure it out, and you say, well, I really don't know how to do this, or I don't know how to do this. I'm really good at this, but maybe there's other elements to the things that I should do. And that's why connecting with a group such as yours not only and I know you've got many different levels in your group. For the CEOs, we all deal with some similar situations, but just being a part of all of the different parts of your group, you're going to learn from so many different people that are going to have, maybe not similar roles, but similar aspirations. And I find that great. It's always humbling to learn how much I don't know about things.
Thank you, Alex. I remember when I reached out to you and sending you so many emails. I think I was sending you emails at midnight, and I'm sorry for that, because I don't give up on great people. I knew that the services that I knew that you may never need us, but I knew that our members needed the services that you offer, and I was keeping my fingers crossed for you to say yes. So I'm happy you said yes, and I'm happy you have been consistent. I'm happy that our members are benefiting, including myself. And your second year, I want us to do more to make it even more successful for you and for our members.
Great.
Awesome.
Yeah.
Awesome. With that said, then Alex, thank you for your time. But I think we'll come back because I've left a few more questions I wanted to ask you. And our viewers, thank you so much for watching. Thank you.